So the Sisonke COVID-19 program for vaccinating healthcare workers has resumed. That's really good news, but of course 2 weeks have been lost while authorities were assessing the possible link with the Johnson & Johnson vaccine and very rare blood clotting disorders. Of course, also the Health Minister has been briefing Parliament's Health Portfolio Committee on the vaccination program, and I'm joined now by Professor Mosa Moshabela, Acting Deputy Vice Chancellor of Research and Innovation at the University of KwaZulu-Natal. Prof, thank you so much for joining us. So the Sisonke trial resumes. In total, I think we'll hope to vaccinate over 1 million healthcare workers, but really the big push is going to be from mid-May when we start phase 2 with hopefully over 5 million 60-plus people getting that jab. The Health Minister has spoken about that to the Portfolio Committee. What do you think the major concerns are at this point?
Yeah, thanks. Greetings, Sally, and to your viewers. I think at this point what we are seeing is that, I also want to concur that actually it's much welcome news that the Sisonke study has been resumed, and hopefully they can get closer to the 500,000 that they committed to. But I can see a shift here that the Minister and government are really focusing on the government rollout, on launching the government rollout with the initial vaccines that will come from J&J. It sounds like the focus is more on that, and also the fact that they have launched the electronic vaccination data system for registration of people who are over 60 years. And I think that in a way that is a really welcome development. What is needed, I think, Sally, is to make sure that we have adequately answered nearly all of the questions that people have in order to put them at ease in going forward with the registration and welcoming the vaccination program when it gets launched by government.
I think you make such an important point. Not only have we lost 2 weeks of vaccination time, but there has been an increase in concern. Also, coupled to that, one of our reporters, Heidi Jokos, reporting to us earlier this week that a lot of people over the age of 60 might not have access to that online registration and have a lot of hesitancy and a lot of worries. So could you explain to us around the Johnson & Johnson vaccine, which was paused for 2 weeks, how real those concerns are? My understanding is there still isn't a definite link between this very rare blood clotting disorder and the vaccine, but already there are protocols in place that if you have any history of potential blood clotting, you need to go to your doctor. Also the advice that pregnant and breastfeeding women should not get the vaccine. How concerning are those issues around the vaccine for you?
I think for me, I'm not concerned, thank you. I think that sadly, government and the scientists, they've done enough, and the regulatory body, they've done enough work to prepare as much as they can in the 2-week break that was taken, which of course was excessive given the fact that there is a sense of urgency in rolling out the vaccine. However, it's much welcome given the anxiety that existed in the country more generally. And from my end, I think that the measures that have been put in place to monitor, to screen, to warn people who might be at risk, who might have symptoms, and to manage people who might have those symptoms of blood clots, I think they're adequate. Anything else really is going to be understood as we move along and as we encounter cases. But these are rare. It's not something that should prevent us from rolling out. And I personally, I think that, we are okay. I do think that people need to have information and need to consent, to give consent to taking the vaccine, knowing that there might be some rare risk that is possible. But otherwise, for me, I do think that it is also a little bit of an injustice that women who are pregnant or lactating mothers are not able to get the vaccine. But that is because the science has not developed further enough to provide good evidence around that. I am hoping that this issue can be resolved as soon as possible because I don't think that it's fair.